Okay, so we've got Chris here. He's been suffering with some knee problems. He had you've had an operation on your knee. What was it exactly?
It was an ACL hamstring graft on my ACL, and they cleaned up my meniscus, which was torn as well.
Okay, cool. So Chris has been having some chiropractic treatment. We've been doing some Reston techniques on the knee, or IAM tools rather. We've also been doing some dry cupping. But one thing that he's been experiencing is every time he exercises, he starts to get some swelling around the knee, and he feels that there's still some residual swelling around the knee that kind of hasn't gone. So we're going to be doing the wet cupping and just seeing if we can release some of that stagnant swelling or the blood around the knee which isn't kind of clearing, and see if that helps him kind of work, help him kind of train better so that he can rehab his knee more efficiently. Okay, so basically I just need to go through some health screening with you to make sure that you're suitable for this, because it's not for everyone. Okay, so you've never had any viruses in the blood before?
No.
Never fainted before?
No.
Never had any seizures or epilepsy? No diabetes? No blood clotting disorders? None of that? Never had anemia, less iron or less blood in the body?
No.
You're okay with scarring? You don't scar? You don't have any problems with scarring, scar easily or anything like that? No poor healing? You okay when you see blood and needles?
Yeah, generally.
Okay. No forms of cancer, no neurological disorders. Your operations?
Yeah, it was ACL, was a hamstring graft, and shaving down the meniscus on this.
Scribble for me here to say that you're okay with it. So the side effects, the possible side effects of having this done, the major side effect really with this is scarring. You can have small scratches or small marks. It's quite uncommon, but it is possible with some patients. Obviously, as I mentioned, you can feel lightheaded. You can feel itchy for about 1 or 2 days after. Especially, sometimes it can sting. So try not to scratch it or anything like that. And yeah, that's pretty much everything.
Fine.
Okay.
Thank you.
Right. Nice healthy blood pressure, 120 over 80. It's not particularly low, which means you're less likely to feel faint or anything like that during treatment.
Yeah.
So we're going to be using these little cups. We're going to be popping them onto the sides of the knee. We're going to create a negative pressure just by using this pump, and that sucks air out, which will create that negative pressure. And as you can see, the blood is increasing around that area, so it increases blood circulation in that area. Then we'll take the cup off after a couple of minutes. We'll make some very small scratches that they're basically tiny nips. They're not deep cuts, and it literally is just a tiny little nip of the skin. We'll pop the cup back on, reapply the suction, and we'll leave it there for a little bit. It can be quite uncomfortable having the suction done. If anything's too strong, then let me know. Also, the little nips, again, some people find them quite painful. Most people find them ticklish, but if there's anything which is too uncomfortable, just know you can stop me at any time. During the treatment, you can feel a little bit lightheaded. We're going to be treating you sitting up, just because we're working on the knee. It's easier to work around the knee that way.
Yeah.
If you do feel lightheaded or dizzy at any time, then just let me know straight away, because we'll lay you down, because you can feel faint. Most of the time, it's from seeing the blood rather than anything else that people feel faint. That's why we asked those questions before. But yeah, it's pretty harmless otherwise. So we're going to start with the procedure now. I'm just going to apply a little bit of oil onto the surface of the knee, just to kind of prevent any air getting into the cup, so we get a nice attachment to the knee. Just going to apply some around the sides here, just smoothing the hair down. Okay. So these are all single-use cups. Everything we use in the clinic is single use for each patient, so there's no chance of kind of infection and these sorts of things happening. Okay, so we'll just pop the first cup on. Okay, you can feel that suction. Okay. Right, so we're going to leave these cups on now for a couple of minutes. Just let the any swelling or inflammation just be drawn to the surface, and then we'll start with some small scratches. Okay, so we're going to start with the small cuts now, and we're can see how it feels. A lot of people ask, was this painful? So I want you to give some feedback on this video of how it's feeling. Okay, so we're going to start with the first cut. Okay, tiny little scratch. Is that okay?
Yeah, that's fine.
Yeah.
Didn't
Okay.
really feel that. So.
Okay, so tiny little nips.
Yeah.
Okay, lots of them.
Yeah. Little spikes.
Okay, that's fine.
Yeah.
Wasn't too bad.
No, not at all. Little scratches.
And pop the cup back on. Okay, and now we're going to go for the next cup. Same thing again, tiny little scratches. this was the one that's turns out it's quite a lot. I'll show you that. How's it going?
Yeah, fine. I'm surprised. It's like I was expecting it to be painful, but it's not. I can't feel anything. That's the thing.
No?
I was expecting to feel lightheaded, but I guess this is only the first go.
Okay, so we've left the cups on for, what's it been, about 7-8 minutes? We're going to start taking them off now, and you can see what happens. Okay, so I'm just going to pop some tissue underneath the cup, going to pop the nozzle to release the air, the pressure starts to release, and now I have to try not to make a mess with this. You can see that the blood's kind of congealed up. Just gently take that away. Okay. Put that little wipe. Okay. Next cup, pretty much the same thing. Put the nozzle, put the cup. Sort of tangle in your hairs. Like that. Feels okay, was that sting?
It's fine.
Okay, and top here. Okay, just a little bit of wound wash, basically antiseptic, just to clean up the area. Okay, so the bleeding is kind of pretty much stopped. You might get the tiniest little kind of drop, if anything, but that will kind of, within the next few minutes, that'll be gone. Okay, so just take it easy for a second. Okay, want to go?
Can do that before.
Yeah.
So, what have you done? Strange, isn't it? Well, not strange. It makes sense.
How was it?
It feels fine. To be honest, I can feel like a bit of release of pressure. There's a little bit of tingling where the scratches are, but other than that, I don't feel lightheaded. It feels good.